our witnesses being here as well. So, Mr. Bell, I'm going to go ahead and start with you. In fiscal year 2024, Medicare and Medicaid combined to account for more than 20% of all federal spending. This means that the HHS Inspector General, who oversees those programs, has a massive responsibility to ensure federal dollars are used appropriately and consistent with congressional intent. So there's a lot of room for improvement at HHS on this, Mr. Bell, and I hope that you will be able to focus your office's resources on these programs if confirmed. The HHS IG has 1,188 open recommendations. That's a lot. I encourage you to take the lead, if confirmed, as the HHS IG to get those resolved. Now, there are a few that caught my attention. The Centers for Medicare and Medicaid Services had not recovered more than $1 billion in Medicaid overpayments identified by OIG audits. Medicare could have saved up to $128 million over 5 years if CMS had implemented control to address duplicate payments for services. So, Mr. Bell, there are many changes overdue at HHS to lower costs and improve access to care for Iowans and all Americans. But if confirmed, would you commit to addressing existing recommendations to reduce and hopefully eliminate overpayments and duplicative payments? Thank you. That's an easy one. Mr. Bell, as HHS IG, you will be responsible for oversight of the National Institutes of Health, NIH. NIH conducts and supports significant groundbreaking research to help Americans healthier. But it also conducts and supports research that has no business getting taxpayer support. This includes studies answering critical questions such as, are pampered cats less likely to poop outside the litter box? Do pigeons gamble? Does this sour cream and onion flavored potato chip look like Elvis? All of these studies are required to provide a public price tag for taxpayers by the Stevens Amendment, but none of them do. In fact, a 2019 GAO report I requested found that none of HHS's operating divisions could demonstrate that they had a process to manage and administer grantees' compliance with the Stevens Amendment. I'm sorry, we spent taxpayer dollars on this. It might look like Elvis, but did we have to spend taxpayer dollars on this? So, from your previous time at HHS, are you aware of other laws that HHS and or those who receive grants or funding from HHS that have blatantly disregarded what you would like to highlight for this committee?
Thank you for that question, Senator. I did see a number of grants and proposals and guidance directions during the first Trump administration that were obnoxious to congressionally passed statutes. Some are just the unfortunate largesse of a bureaucracy with a lot of other people's money to spend and the ability to, in an unaccountable way, to spend that money outside the brackets of congressional law.
Yes, well, thank you. And I think that we need to really pay attention. I've spent a lot of my last 11 years focusing on waste, fraud, and abuse within our federal government. And these are a few of the egregious examples of the misuse of taxpayer dollars. We need better oversight. We need compliance with the laws that are already in existence. So my message today is I don't think anybody agrees we should be spending money on a potato chip. I don't believe that. And I'm sorry, the litter box thing, let some private company pay for that if they're focused on kitty litter, whatever it might be. But let's not spend taxpayer dollars on garbage like this. So I appreciate that. We have additional questions. I'll submit those for the record. But I really want to thank you. Let's make sure we're focused on effective ways that we can use our taxpayer dollars for the right and intended use.
Gladly.
Thank you very much. Thank you, Mr. Chair.